this agenda item is related to looking at draft guidance on food allergens. You have the relevant document there, and you see the status in the Codex step process. It's at step 3. Step 3 meaning that right now we are at the comment stage, and basically now we're going to be moving during the committee discussion at step 4, which is the committee discussion. And we're hoping, in fact, that some of the texts, if not all, would move to the final stage of adoption, or at least the draft adoption stage as at step 5. So let me give you a little bit of a background on this agenda item. So a little bit of history on this agenda item. In fact, this agenda item started back at CCFL47, so essentially 2 committees ago, where it was identified that the Codex Committee on Food Labeling did not revisit the issue of labeling of allergen for close to 15 to 20 years. So essentially, the issue of allergies and the way allergens are managed, and the importance of labeling as a tool to manage allergens was not revisited by Codex since 1999. That's when the standard of food labeling, so CXS 1985. By the way, CXS 1985 is one of the most fundamental Codex standards. So that standard was amended in 1998 to include some provisions related to allergen labeling, but it was not revisited since then. So there was an indication at that point that we needed to revisit the standard, and we needed to revisit the standard with a particular focus. One of the areas of focus was to say that since the standard was adopted in 1998, we saw a different practice of labeling related to allergens, and this labeling practice was the use of the may contain statement. So when you see now a lot of foods, you see a lot of not only the declaration of allergens as ingredients, but you see a lot of may contain something. And that may contain peanut, may contain almond, etc., is not covered by a Codex guidance. And we're seeing basically it's the Wild West, I would say, in the way the application of the may contain statement is made. And that's what CCFL was asked to revisit. This happened at a time when the Codex Committee on Food Hygiene, CCFH, worked on a code of practice related to allergen management. And that code of practice was adopted about 2 years ago. So CCFL was asked then to look at reviewing the standard CXS 1985, looking first at the PAL. I'm going to use the word PAL, P-A-L. You know, this is the Precautionary Allergen Labeling. So when I say PAL, that's Precautionary Allergen Labeling, okay? So revisiting the PAL issue, but also recognizing that the list of priority allergens that were identified. So what are priority allergens? Priority allergens are those ingredients that when they are present in a food, they trigger a mandatory declaration of ingredients. So this list has not been revisited since 1998. You have heard the notion of the big 8. You know, the big 8, it's peanut, it's tree nuts, it's wheat, soy, etc. Those are egg, milk. That big 8 list was not reviewed since that period. So CCFL was asked to look at the big 8, review it and potentially update it, but also to look at developing guidance on the precautionary allergen labeling. Now, to be able to do that, CCFL recognized that it did not have all the scientific information available, and that it needed to ask FAO and WHO to conduct a scientific assessment. So this was conducted, and there were in fact a few questions that were asked to FAO and WHO. This did not go, by the way, to JECFA. It went to an ad hoc expert consultation that was managed by FAO, WHO. And this expert consultation looked at, first, the criteria related to what we can consider to be a priority allergen. Second, they looked at information related to thresholds of allergies. This is recognizing the fact that allergies are not reactions or affections that happen at any level. You need a trigger level above which you have the allergy. And if you are below that level, basically, if you are an allergic consumer, you may not necessarily have a reaction. So this expert consultation was asked to look at those thresholds. And the third question was to say, can you support Codex by providing scientific evidence that will help better manage how precautionary allergen labeling could be used? So those were the three questions. And in fact, you will see that the reports related to this expert consultation were made available. In fact, this expert consultation was convened at least 3 times, and 4 reports were issued, and they are in fact available and accessible in the document that was shared with you. Now, after the expert consultation was made available, CCFL worked on this item through an electronic working group that was chaired by Australia and that was co-chaired by the United Kingdom and the United States. And in fact, what are we going to be discussing next week? We're going to be discussing, first of all, the update of this list, the update of the list of what is known as the priority allergens. Basically, we're going to be going into CXS1 1985, and we're going to be looking at the provisions related to food allergens, and we're going to be reviewing them and updating them. So that's the first element. The second element of discussion will be to look at how the precautionary allergen labeling is managed. And in fact, here CCFL47 will be examining a separate guideline on precautionary allergen labeling. Now, let's look at what was proposed and essentially how we can analyze what is the situation right now. When you look at the list of priority allergens, basically the output of the expert consultation came to say we should be considering 3 criteria for how an ingredient could be classified to be a priority allergen. Those 3 criteria are, first of all, the prevalence of the food allergy for that ingredient. But the prevalence should be considered at the global level, okay? The second criterion is severity. The reaction that is associated to the consumption of that ingredient should be severe. Severe meaning that it can lead potentially to the death of the individual. So essentially anaphylaxis, for example. And the third criterion is what we call potency. Potency is, it means that you don't need a lot of that food to produce a reaction. So essentially, you may have a reaction at very low levels. So those are the 3 criteria that were developed by this expert consultation. And in fact, the group of experts reviewed the Big 8. And what they found out is that, well, some of the products do not meet the definition of Big 8 anymore. Soy, for example, was recommended to be excluded from the list. Sesame was recommended to be included in the list. So now, essentially, sesame, as you know, is a very important product that is consumed and produced in the Middle East and in North Africa, a lot actually in the Middle East, I would say. And I mean, tahine is one of the byproducts, right, of sesame. So now sesame will be considered, if essentially this is accepted by CCFL, it will be considered as a priority allergen. And if it is considered as a priority allergen, it means that it needs to be managed both for the ingredient declaration as well as for the precautionary allergen labeling declaration. So that's why, I mean, I'm saying this has an importance for us. The second decision related to the priority allergens that CCFL will be examining, and this is again directly resulting from the expert advice. The second element is that the CCFL will be looking at potentially now that we need to have a secondary list of priority allergens. So the first list of big 8 with the modification, less soy plus sesame. But the second list, we say there might be allergens that may not be valid at the global level, but they are valid at the regional level. And this is, for example, to consider some allergies that are witnessed in Europe, for example, for mustard, allergies that are witnessed in Asia for buckwheat, allergies that are witnessed in some other areas related to celery, for example. So essentially, these are areas where now Codex will be recognizing that there is a regional component to allergies and will be considering a second list. Now, what I would like us to see is how the Codex text was proposed in this area. And now I'm going to give you my input and my analysis, as I guess also I consider myself one of the food allergen experts in this particular area, because I've been working on food allergen management for a number of years. And my analysis is that the proposal that is made is incomplete. So when you look at what the text now that is proposed is, the text right now says in 4.2.1.4 of CXS1 1985, the text reads as follows: the following foods and ingredients are known to cause hypersensitivity, food allergy or celiac disease, and shall always be declared using the name specified. So essentially what the text says is that if these foods are there, they need to be declared. But I consider, in fact, and our analysis considers that this is incomplete. Why this is incomplete? Because this will lead, if the text is applied the way it is, which is the old text, but the only change is the list now, this will lead to potentially over-labeling. In what sense? It means that if you have an ingredient that is extracted from this big 8 and that is present in the food, you will have to have a declaration, including if your ingredient does not contain the part that causes allergies. In fact, this particular text fails to recognize that the element of the ingredient that causes the reaction, and therefore that should mandate the declaration, is proteins. The element for which you have a reaction is not the entirety of the food. It's only when you have the protein there. So I'm going to give you an example here. You know, maltodextrin, which is essentially an extract that you can have out of wheat. Maltodextrin is essentially an ingredient that is derived from wheat, but it is sugar. And in the way it is produced, the sugar component is actually very pure. You don't have protein in it. So if you don't have a protein in it, a product that has maltodextrin, and because maltodextrin is coming from wheat, according to this text, if it's not modified, it has to make the declaration of wheat. But in fact, that product is not dangerous. So this will lead to an over-declaration. So our proposal here is to make, in fact, a change in this proposal and to recognize that the declaration is mandatory only in one situation. And that's when the protein fraction of these foods is present. And not only is present like that, it's present as a result of a deliberate addition to the food composition. Because if it's present as a result of cross-contamination, that's a different type of text. It's the precautionary labeling. So here we are suggesting that 4.2.1.4 be amended and actually to recognize that it's only when the protein fraction of these foods and these ingredients is present as a result of the deliberate addition that it shall be then, as a result of such presence, always be declared. So this is our first suggestion of change you see in the text that will be proposed. The second suggestion of change that we're having is related to the way the list of food allergens of regional relevance is listed. Now, here, if you look at the text, the way it was proposed, for this part, and this is in the way a new section was added. This new section is called 4.2.1.5. This text, the way it is listed, seems to indicate that it's only the foods that are listed in this particular section that should be considered as of regional relevance. In fact, here, what we want to make sure is that Codex or the Codex text identifies that there may be other foods that may be of regional relevance as long as these other foods are resulting from an evaluation that follows the way Codex did its evaluation, meaning the 3 criteria. So essentially here, our comment is that the way this is listed may be too restrictive and fails to recognize that that list may need to evolve for some regions of the world, because honestly, the expert consultation did not evaluate everything. There's also another point that is in that list. If you see that list includes oats as one of the elements. And oats, in fact, is or was in the previous list simply because oats could be contaminated with wheat, and therefore oats could be dangerous to celiac individual. In fact, when you look at pure oats, which contain a different type of protein, these proteins are called adenines. The composition of adenines are of a nature that they are not toxic to celiac disease patients. So therefore here, we have a recommendation as well to remove oats from the list, even from the secondary list, because the cause of toxicity of oats for celiac patients is not because of oats, but it's related to the purity of oats. So this is a second comment that actually we are making on this particular list. Now, before I move to the second part, because this is actually, these are the comments that we have on the way section 4.2.1.4 and section 4.2.1.5 would be changed in the first text. I would like to ask your your comments here before I move to the second guideline. So سأتوقف قليلا هنا وأرى هل هناك أسئلة على الجزء الأول، كيفية التنقيح المقترح للبند 4214 وأيضا لكيفية إدخال البند 4215 للمواصفة المتعلقة بتوسيم المواد المغلفة، وأيضا كيف تم تحديث ذلك والاقتراح المعروض علينا.
شكرا أخي سامي، تحليل رائع ومفصل. فالأخ سالم رافع اليد، عنده تعقيب مداخلة. تفضل أخي سالم.
سليم
أو سليم الأستاذ سليم نعم.
تحياتي وشكرا لك دكتور صمويل على التحليل اللي قدمته بخصوص الالرجنز. حقيقة يعني أنا بجوز التوصيتين الثاني والثالث اللي وصيت فيهم يعني أتفق معك فيهم، لكن بالنسبة للتوصية الأولى طبعا يعني هي نصوص الدستور الغذائي مبنية على ريسك أسسمنت، والريسك أسسمنت طبعا يعني جزء منه هو يعني كيف تقبل وتعامل المستهلكين مع الغذاء. وإذا بدنا ننظر لفئة المستهلكين بجوز مش بس في الوطن العربي بس كمان في جميع دول العالم. يعني أنت بتقترح مثلا إنه نذكر اسم البروتين المسبب للحساسية، أو إذا وجد اسم البروتين المسبب للحساسية بدل اسم الغذاء إنه نذكر إنه يحتوي على البروتين المعني أو المقصود. لكن معظم المستهلكين يعني أنا هيك فهمت من الكلام.
عفوا، ربما هنا لو تسمح لي أستاذ سليم، ربما هنا أنا لم أعبر عن ذلك بطريقة جيدة. أنا لا أطلب ذلك، بالعكس أنا متوافق إنه كيفية ذكر المادة المحسسة المسببة للحساسية يجب أن تكون بطريقة تفهم من قبل المستهلك، أي باسم الغذاء، يعني the specified name، بطريقة سهلة للمستهلك. لكن ما طلبته وما رأيته هنا إنه النص المقترح لا يتوافق مع تقييم المخاطر. هذه الإشكالية، لأنه تقييم المخاطر يقول إنه الحساسية يتم تسببها فقط لما يكون الجزء البروتيني موجود في الغذاء. فعندما يكون الجزء البروتيني الموجود في الغذاء، هنا تجدر إلزامية التوسيم بذكر الاسم العادي، الاسم المعلوم. أنا ما أراه أنه هنا طريقة التكست هنا هي تجعلنا نوسم أغذية لا تحتوي على الجزء البروتيني، أي هي ليست ضارة للمستهلك المصاب بالحساسية، ولكن تجعلنا نضع يحتوي على الحبوب أو يحتوي على القمح مثلا، وهو الجزء الذي يحتوي عليه هو الجزء الغير البروتيني، أي الجزء الذي لا يسبب للحساسية. فنحن نتسبب بالطريقة التي موصوفة هنا إلى over labeling، يعني نوسم شيء نقول أنه يحتوي على القمح وهو يحتوي على جزء لا يسبب للحساسية للقمح. You see what I mean؟ لأنه الطريقة المقترحة لا تتوافق مع تقييم المخاطر.
واضحة وأنا إذا كان سوء فاهم مني، شكرا لك دكتور صمويل.
شكرا. والنقطة الثانية التي اقترحتها هي أنه الليستة المقترحة بطريقة كتابتها هم يقولون أنه هذه الليستة فقط. نحن نقول أوكي، هذه الليستة يمكن أن تكون هذه الليستة من جملة الأشياء الريجنال يعني الإقليمية، ولكن ممكن أن تفتح الليستة لأشياء إقليمية أخرى التي يمكن اعتمادها طالما تم اعتمادها احتسابا لتقييم المخاطر مقارب لتقييم المخاطر الذي قام به فريق الأخصائي للFAO WHO. فهذم الاقتراحين الذين قمنا بها نقوم بها.
واضح أخي سليم؟ واضح؟ أخت حنان؟
شكرا دكتور أحمد، شكرا دكتور سام، ميرسي جدا على البرزنتيشن، عرض جيد جدا. وبالنسبة للمقترحات، هي المقترحات جيدة جدا، بس طبعا المستندات دي هي مثلا هي درست في كل الدول وتعدى بيها ردود ترد على كل المستندات للكودكس. بس يعني أنا مش شايفة إن في مشكلة إن إحنا برضو التوصيات اللي قالها دكتور سام ننظر فيها تاني قبل الاجتماع CCFL. يعني أنا بالنسبة لنا إحنا معايا دلوقتي حاليا في الاجتماع الدكتورة زينب مسعد، الأمانة الفنية للجنة الليبلينج، وهي اللي مسؤولة عن الردود المستندات الخاصة المستندات الخاصة باللجنة، وهي كانت هي اللي عملت الردود بتاعت مصر. فهي أبدت ترحيبها بأن هي تعرض التوصيات بتاعت دكتور سام على اللجنة تاني، ولو في CRD هتتقدم من خلال دكتور سام، احنا ان شاء الله باذن الله لو اللجنه وافقت هندعم CRD دي وهندعم التوصيات دي ان شاء الله. وبنشكر عمان على الدعوه الكريمه اللي هي ان شاء الله نقاط الاتصال في الشهر الجاي ان شاء الله باذن الله. شكرا.
شكرا أخت حنان، شكرا جزيلا. في أي حد حاب يتدخل، عنده تعقيب أو عنده ملاحظات أو عنده استفسار؟ تكمل أخي سامي، كمل.
شكرا جزيلا. ربما هنا أيضا تعقيب للأستاذة حنان حول يعني كيفية عرضنا لهذه التوصيات. طبعا لنا الوثائق التي ذكرناها هنا، لكن هذه الوثائق هي فقط وثائق تحليلية. فكما قلت أستاذة حنان، نحن سنقوم بإعداد CRD مفصل ب proposals of changes، يعني مقترحات تغيير النص لكي تكون سهلة أيضا لإعداد المواقف الوطنية. وطبعا سنشاركها معكم. لم يتسنى لنا يعني إنهاء إعدادها الآن، لكن سنحاول أن تكون جاهزة ما بين الآن والاجتماع. وأيضا نرحب أيضا بإمكانية أن تكون هناك اجتماعات تنسيقية في كندا بالنسبة للوفود التي ستكون متواجدة هناك، وسنتحدث في هذا ربما بعد نهاية هذا العرض في كيفية التنسيق العربي المشترك يعني عند الاجتماع نفسه.
ان شاء الله. احنا كما جرت العاده ان شاء الله نعموا عليكم استماره وتاكدوا لنا من هي الدول اللي الاشخاص اللي راح يكونوا حاضرين، حتى يكون هناك اجتماع تنسيقي. صح اخي سامويل، اجتماع تنسيقي هناك في اي مكان، ونصف المواقف والامور اللي تخدم مصالح المشاريع. في اي تعقيب او اي استفسار؟ المرأة اخي سامويل
استاذ
اعتقد.
استاذ حنان. استاذ حنان
هو
تفضل
انا هو بالنسبه للسي ار دي، هو يا ريت يكون يعني لو هيتعمل فعلا يبقى بدري شويه عشان نلحق ان احنا نقدر نشتغل عليه. دي حاجه. ثانيا هو طبعا في مشكله في التاشيرات، ويمكن دكتور سام عارف. فانا كنت عايزه اقترح اقتراح كده، لو ينفع ان الاجتماعات اللي اللي الدكتور سام بيعملها هناك مع نقاط الاتصال، هل تنفع تبقى هايبرد؟ يعني احنا نشارك فيها واحنا موجودين هنا، بحيث ان احنا نقدر ان احنا نشارككم هناك وانتوا هناك انتوا بتعملوا مع اجتماعات مع الوفود العربيه، يبقى الوفود الثانيه برضو مشاركه، بحيث ان احنا لما نيجي نعمل راي نبقى عارفين انتوا وصلتوا لايه ومؤيدينكم في الراي ومش معارضين ليكم. لان احنا طبعا واللي بيحضر اجتماع اونلاين ما بيبقاش عارف ايه اللي بيحصل هناك بالظبط. فلو في امكانيه هناك ان يتعمل اجتماع زوم مع اللي حاضرين واحنا نأيدكم، ده هتبقى بالنسبه لنا يعني اعتقد ان هي هتبقى حاجه كويسه جدا. تاني حاجه، انا مش عارفه برضو الاجتماع بالنسبه للهايبرد اللي هم هيعملوه، هل هيبقى فيه امكانيه للاونلاين ان هم يوافقوا او يعترضوا او اي حاجه؟ لو ما فيش امكانيه برضو حابين، لو احنا انا برضو بفكر ان احنا الدول اللي مش هتقدر تروح والسي ار دي اتوزعت عليها، واحنا شايفين ان احنا موافقين على الريكومنديشنز دي، ان احنا ممكن ان احنا نبعت كمان سي ار دي بنأيد الريكومنديشن اللي هي جايه في السي ار دي بتاعت دكتور سام. ده اللي انا كنت عايزه اوصله. شكرا
شكرا جزيلا.